Most grandparents think they're safer babysitters than young parents because they have experience. But research from the Journal of Pediatrics shows grandparents are actually involved in more preventable accidents with children under 5 than any other caregiver group. That's not because you love your grandchildren any less. It's because the rules changed while you weren't looking, and some of what you did perfectly well with your own children is now medically proven to be dangerous. I'm going to show you 10 hidden dangers that are sending children to emergency rooms right now, and I'll explain exactly why these things happen at the cellular and physiological level so you understand what's actually going wrong inside your grandchild's body. By the end of this, you'll have specific action steps that will make you the safest caregiver in your grandchild's life. And I'm going to reveal something near the end about sleep positioning that will shock you because it contradicts everything we believed 30 years ago. Let's start with honey. You probably gave honey to your babies. It soothed coughs, it helped them sleep, and it seemed completely natural. But if you give honey to a baby under 12 months old today, you're risking infant botulism. And here's exactly what happens inside their body. Honey contains Clostridium botulinum spores. In adults and older children, stomach acid destroys these spores immediately. But babies under 1 year have insufficient gastric acid production. Their stomach pH is higher, less acidic, which means those spores survive the stomach, travel to the intestines, and germinate there. Once active, these bacteria produce botulinum toxin directly inside the infant's gut. This toxin blocks the release of acetylcholine at neuromuscular junctions. Acetylcholine is the chemical messenger that tells muscles to contract. When it's blocked, muscles become paralyzed. The paralysis starts with constipation because the intestinal muscles stop moving. Then, facial muscles weaken. The baby develops a weak cry, has trouble sucking and swallowing, and loses head control because neck muscles fail. Eventually, respiratory muscles become paralyzed and the baby stops breathing. This isn't rare. The CDC reports over 100 cases annually in the United States, and many cases are traced directly to well-meaning grandparents who didn't know the rules changed. No honey before age 1. Not in bottles, not on pacifiers, not mixed in. Food, 0. Second danger is overheating during sleep, and this connects directly to sudden infant death syndrome. Your instinct is to keep babies warm. You were probably told babies get cold easily, so you bundle them up, add extra blankets, keep the room toasty. But here's what actually happens physiologically when a baby overheats during sleep. Babies cannot thermoregulate the way adults do. They have a larger surface area to body mass ratio, and their hypothalamic temperature regulation is immature. When a baby gets too hot during sleep, several dangerous processes start. First, metabolism increases to try to cool down, which increases oxygen consumption. But overheating also causes peripheral vasodilation, where blood vessels near the skin expand to release heat. This drops blood pressure. In deep sleep, an overheated baby's brain may not trigger the normal arousal response to low oxygen or high carbon dioxide levels. There's a failure of the arousal reflex. The baby should wake up when something goes wrong, but overheating suppresses this protective mechanism. Studies from the European Journal of Pediatrics show that room temperatures above 70 degrees Fahrenheit, combined with excessive clothing or blankets, increase SIDS risk by up to 5 times. The recommendation now is a room temperature between 68 and 72 degrees, a sleep sack instead of blankets, and babies should sleep in just one more layer than an adult would wear in the same room. Feel the back of the baby's neck. If it's sweaty or hot, remove a layer. This applies even in winter. I know you want to keep them cozy, but overheating is genuinely dangerous. Third hidden danger is outdated car seat information, and this is killing children. If you're using a car seat you saved from when your own children were young, or if you're installing a modern car seat the way you remember doing it decades ago, you're creating a fatal risk. Here's why. Car seat technology has completely changed. Older car seats don't meet current crash test standards. The plastic degrades over time, especially if stored in attics or garages where temperature fluctuations cause molecular breakdown. But even with a new car seat, installation errors are the biggest problem. The National Highway Traffic Safety Administration found that 73% of car seats installed by grandparents are installed incorrectly in ways that could cause serious injury or death in a crash. The most common error is loose installation. The car seat should not move more than 1 inch side to side or front to back when you pull hard at the belt path. If it moves more than that, in a crash, the child becomes a projectile. Here's what happens to a child's body in a crash with a loose car seat. In a 30-mph collision, a 20-pound baby experiences a forward force of 600 pounds due to deceleration. If the car seat isn't tightly secured, it rotates and slides forward. The child's head, which is proportionally much larger and heavier in infants, snaps forward violently. The neck ligaments and vertebrae cannot handle these forces. Cervical spine injuries occur, brain bleeding happens from the shaking motion, and internal organs tear loose from their attachments. Another critical error is forward-facing too early. Toddlers should be rear-facing until at least age 2, and preferably longer. The American Academy of Pediatrics changed this recommendation in 2018 based on crash data showing rear-facing reduces serious injury by 75% compared to forward-facing for children under 2. The reason is biomechanical. In a frontal crash, which is the most common type, a rear-facing child's entire back, torso, and head are supported by the car seat shell. The force distributes across the whole body. In a forward-facing position, the head and neck snap forward, and all the force concentrates on the neck. In young children, the head weighs about 25% of total body weight compared to 6% in adults. The neck structures simply cannot handle it. Take your car seat to a certified child passenger safety technician for inspection. Every fire station or hospital has them. Free service? Do it before the next time you drive with your grandchildren. I'm going to tell you about choking hazards in a minute, but first, let me address something that's going to save you worry later in this video. Many of you are thinking you did things differently and your children turned out fine. That's true, but survival isn't the same as safety. We also didn't use seatbelts for decades, and most people survived, but thousands didn't. Once we learned better, we changed. That's what's happening here. I'll show you exactly which of your old methods are fine and which ones are medically proven dangers. Fourth danger is choking, but not the foods you think. Yes, hot dogs, grapes, and popcorn are choking hazards, but the hidden danger is that grandparents often don't recognize choking when it happens, and the rescue techniques you learned decades ago have changed. Let me explain what actually happens during choking at the anatomical level. The trachea in a young child is the diameter of their pinky finger, roughly 4–6 millimeters. A single grape, if inhaled, completely occludes the airway. When the airway is blocked, oxygen can't reach the lungs. Blood oxygen saturation drops immediately. Brain cells begin dying within 4 minutes of oxygen deprivation. Children often can't cough when completely choking because coughing requires airflow. Instead, they become silent. Their lips turn blue from cyanosis, and they may grab at their throat. This is called the universal choking sign. But many grandparents see a child coughing or gagging and rush to intervene with back blows or abdominal thrusts when they shouldn't. Here's the current guideline. If the child is coughing, even violently, do not interfere. Coughing means air is moving, and coughing is the body's most effective way to clear an obstruction. Only intervene if the child cannot cough, cannot cry, cannot breathe, or is silent. The technique has also changed. For infants under 1 year, you alternate 5 back blows with 5 chest thrusts. Never abdominal thrusts on an infant because you'll rupture their liver. For children over 1 year, abdominal thrusts are appropriate, but the hand position is different than the Heimlich you learned. Your fist goes above the navel but below the ribcage, and you thrust inward and upward. But here's what many grandparents miss. Food modification. Grapes must be quartered lengthwise, not just cut in half. Hot dogs should be quartered lengthwise too, not cut into coins. Any coin-shaped food can plug the trachea perfectly, and timing matters. Don't feed children while they are in car seats or playing. The American Academy of Pediatrics published data showing that 77% of choking deaths in children under 5 happen when the child is moving, distracted, or lying down. Sit them down, minimize distractions, and supervise every bite until age 4. Fifth hidden danger is medication dosing, and this sends more children to emergency rooms than almost anything else. The danger isn't that grandparents give wrong medications, it's that you use dosing strategies from decades ago that cause overdoses. Here's what changed. We no longer dose children's medications by age, we dose by weight. When you give 1 teaspoon for a toddler, based on the age recommendation on an old medicine bottle, you might be giving AAA, the safe dose to a small child, or underdosing a large child. Let me explain what happens with an acetaminophen overdose, because this is the most common medication error. Acetaminophen is metabolized in the liver by conjugation, where it binds to sulfate and glucuronide and is safely excreted. But when you give too much, those conjugation pathways become saturated. The excess acetaminophen goes through a different pathway involving the enzyme CYP2E1, which produces a toxic metabolite called NAPQI. NAPQI binds to liver cell proteins and causes hepatocyte death. The liver begins to fail. Symptoms don't appear for 12–24 hours, so by the time you notice something wrong, massive liver damage has occurred. Children need liver transplants. Some die. The safe dose is 10 to 15 milligrams per kilogram of body weight every 4 to 6 hours. A 25-pound toddler weighs about 11 kilograms, so safe dose is 110 to 165 milligrams. Children's liquid acetaminophen is usually 160 milligrams per 5 ml teaspoon. 1 teaspoon is fine, but if you give 2 teaspoons because the child seems really uncomfortable, you've given 320 ml or nearly triple the safe dose. After 3 or 4 doses, you're in overdose territory. Never give any medication without checking with the parents first about the correct dose. And never give aspirin to children or teenagers because of Reye's syndrome, a potentially fatal condition where brain and liver swelling occurs. This was discovered in the 1980s, so if you raised children before then, you might have used baby aspirin. Don't now. Let me tell you where we're going next, because this is important. I'm going to reveal the danger about food allergies that's putting children in anaphylactic shock. Then I'll show you the bathroom hazards that cause drowning in homes. And later I'll explain the sleep position rule that's completely opposite from what you did with your babies. Drop a comment and tell me which of these dangers you've witnessed personally, or if you've already made any of these mistakes. No judgment here. We're all learning. Sixth danger is dismissing food allergies. Many grandparents grew up when food allergies were rare, and there's a tendency to think parents today are overprotective or that a tiny taste won't hurt. But pediatric food allergies have increased 50% in the last 20 years, according to research from JAMA Pediatrics, and anaphylaxis can be triggered by microscopic amounts of allergen. Let me explain what happens in the body during anaphylaxis, because understanding this will make you take allergies seriously. When an allergic child is exposed to their allergen, even through cross-contamination, their immune system recognizes the food protein as a threat. Mast cells throughout the body release massive amounts of histamine, leukotrienes, and other inflammatory mediators. These chemicals cause widespread vasodilation, where all the blood vessels expand and become leaky. Fluid shifts out of blood vessels into tissues, causing swelling. Blood pressure drops precipitously because the vascular space has expanded, but blood volume hasn't increased. This is distributive shock. The heart tries to compensate by beating faster, but there's not enough blood volume to maintain perfusion to vital organs. The brain doesn't get enough oxygen, and the child loses consciousness. Simultaneously, histamine causes bronchospasm, where the smooth muscle around the airways constricts. The child can't breathe. Swelling occurs in the throat and tongue, further blocking the airway. Without immediate epinephrine, which reverses all these processes by causing vasoconstriction and bronchodilation, the child can die within minutes. This isn't an exaggeration. I've seen parents send explicit instructions that their child is allergic to peanuts, and a grandparent gives a peanut butter cookie thinking a small amount will help the child get used to it, or believing the allergy can't be that serious. That child ends up in an ICU. If your grandchild has a diagnosed food allergy, read every ingredient label. Ask about cross-contamination. Never give the allergen in any amount. If the parents send an EpiPen, keep it with you every second the child is in your care, know how to use it, and call 911 immediately if you use it. The epinephrine is temporary, and the child needs emergency care even if they seem better. Seventh danger is water safety, specifically bathtubs and toilets. Drowning is the leading cause of accidental death in children ages 1 to 4, and most people think of pools. But the hidden danger is that children drown in homes in bathtubs, buckets, and toilets, often while grandparents are supervising. Here's how fast this happens. A toddler is top-heavy because their head is proportionally large. If they lean over a toilet or bucket and tip forward, they don't have the upper body strength to push themselves back out. They panic, inhale water, and drown in less than 2 minutes. 2 minutes is the time it takes to answer the door or grab a towel from another room. In drowning, the first response is breath holding. But within 30-60 seconds, the hypoxic drive, the desperate need for oxygen, forces an involuntary inhalation. Water enters the larynx and triggers a laryngospasm, a protective reflex where the vocal cords close tightly to prevent more water entering. This blocks the airway completely. No air gets to the lungs. Oxygen in the blood depletes rapidly. Loss of consciousness occurs within 1 to 2 minutes. The laryngospasm eventually relaxes and water floods into the lungs. But by this point, the child is unconscious and cannot be rescued without intervention. Brain damage begins within 4 to 6 minutes. Here's the rule. Never leave a child alone in or near water for any reason, even for a second. If you're bathing a grandchild and the doorbell rings, wrap the child in a towel and take them with you. Don't leave them in the tub. Keep bathroom doors closed and toilet lids down with child-proof locks. Empty all buckets immediately after use. Supervision means you are within arm's reach, watching constantly, not in the same room on your phone, not just listening from the next room. Eighth danger is outdated sleep advice. And here's the shocking part I mentioned earlier. Everything you knew about safe sleep is wrong. You put your babies to sleep on their stomachs because that's what doctors recommended. It prevented flat spots on the head, and babies seemed to sleep better. But since the early 1990s, research has definitively proven that stomach sleeping increases SIDS risk by up to 13 times. Let me explain the physiology. When a baby sleeps on their stomach, the face may press against the mattress or bedding. This causes rebreathing of exhaled carbon dioxide. Normally, when CO2 levels rise, the brain triggers an arousal response and the baby wakes up or turns their head. But in some babies, this response is impaired. The theory is that stomach sleeping combined with other risk factors like overheating or soft bedding creates a situation where the baby doesn't wake up when oxygen drops or CO2 rises. Additionally, stomach sleeping may compress the jaw forward, narrowing the airway. And stomach sleeping puts pressure on the carotid arteries in the neck, potentially affecting cerebral blood flow. Since the Back to Sleep campaign started in 1994, recommending all babies sleep on their backs, SIDS rates have dropped by more than 50%. This is one of the most successful public health interventions in history. But here's the problem. Many grandparents still believe stomach sleeping is safer or better. If you're babysitting overnight, you might put the baby on their stomach because that's what worked for your children. You're recreating the exact conditions that cause SIDS. Always place babies on their backs to sleep on a firm, flat surface with no pillows, blankets, bumpers, or stuffed animals in the crib. The crib should be empty except for a fitted sheet. Use a sleep sack if you're worried about warmth, and never let a baby sleep in a car seat, swing, or bouncer for extended periods. These positions can cause positional asphyxiation, where the head falls forward, chin to chest, and the airway closes. Ninth danger is trampoline use. And I know many grandparents have backyard trampolines thinking it's good exercise and fun for grandchildren. But the American Academy of Pediatrics has explicitly recommended against recreational trampoline use for children since 1999, based on injury data. Here's what happens biomechanically. When a child jumps on a trampoline and lands, the mat decelerates them with a force that can be several times their body weight. If two children are jumping, which always happens even though rules say one at a time, they create an unpredictable surface. The lighter child gets launched higher when the heavier child lands. This causes loss of control, and children land on their neck, back, or head. Cervical spine fractures occur. The spinal cord is injured, causing paralysis. Traumatic brain injuries happen from head impacts, but the most common injury is fractures of the long bones and dislocations of the elbow. Over 100,000 trampoline injuries annually are treated in U.S. emergency rooms, and children under 6 have the highest injury rates. The injury happens because children's bones are still growing. They have growth plates, areas of developing cartilage near the ends of long bones. These growth plates are weaker than the surrounding bone. When a child lands wrong on a trampoline, the force exceeds what the growth plate can handle, and it fractures. These growth plate fractures can cause permanent deformity and limb length discrepancies if not treated properly. Even with nets and padding, trampolines are dangerous. If you have one, don't allow grandchildren under 6 to use it. Never allow multiple jumpers, and supervise constantly. Better yet, find other forms of exercise. 10th hidden danger is sun exposure and heat illness, especially if you're from a generation that spent hours outside without sunscreen. Childhood sunburns significantly increase the risk of melanoma later in life. Just one blistering sunburn in childhood doubles the lifetime risk of melanoma. But the immediate danger is heat stroke. Children overheat faster than adults because they have a higher metabolic rate per kilogram of body weight. They produce more heat during activity, and they have less efficient sweating. Their thermoregulatory system is immature. Here's what happens in heat stroke. When core body temperature rises above 104 degrees Fahrenheit, proteins in cells begin to denature. This is literal cooking of tissue. The brain is especially vulnerable. Brain cells swell and die. The blood-brain barrier breaks down. Seizures occur. The liver and kidneys fail as cellular necrosis occurs. Blood clotting factors are consumed, leading to disseminated intravascular coagulation, where clots form throughout the body and bleeding occurs simultaneously. The heart rate becomes dangerously fast and irregular. Without immediate cooling and emergency treatment, heat stroke is fatal in up to 80% of cases. Warning signs include confusion, loss of consciousness, hot, dry skin without sweating, rapid heartbeat, and seizures. But by the time these signs appear, it's a medical emergency. Prevention is critical. Never leave a child in a car, even for a minute. Car interior temperatures can reach 120 degrees in minutes. On hot days, limit outdoor activity to early morning or evening. Dress children in light, loose clothing. Push fluids constantly, especially water. Babies need breast milk or formula more frequently in heat. And use sunscreen religiously. SPF 30 or higher, applied 15 minutes before going outside, reapplied every 2 hours, or after water play. Now let me give you an action plan because knowing about dangers isn't enough. You need specific steps. First, have a conversation with your adult children about current safety guidelines. Don't be defensive. Tell them you want to learn the updated recommendations. Ask them to write down their rules for sleep, feeding, allergies, medications, and car seats. Keep this list on your refrigerator. Second, child-proof your home even if grandchildren don't live with you. Get down on your hands and knees and look at your home from a child's height. Secure furniture that could tip over. An average of 1 child dies every 2 weeks in the U.S. from furniture tip-overs, usually dressers. Anchor bookcases, TVs, and dressers to walls. Put outlet covers on all electrical outlets. Lock up medications, cleaning products, and any potential poisons. The poison control number is 1-800-222-1222. Program it into your phone now. Third, take an infant and child CPR class specifically designed for the current guidelines. The techniques change every 5 years based on new research. Hands-only CPR is now recommended for adults, but children still need rescue breaths because their cardiac arrests are usually respiratory in origin. Find a class through the American Heart Association or Red Cross. Fourth, get your car seat installation checked by a certified technician and have them teach you proper installation. Fifth, if you're babysitting regularly, ask the parents to do a trial run where you follow all their safety rules while they're present so they can correct any misunderstandings. This prevents conflict and builds trust. Let me address something I know some of you are feeling. You might think this is all overprotective, that children today are bubble wrapped, and that common sense is enough. I understand that reaction, but here's what changed. We now have data. Decades of research, millions of case studies, injury surveillance systems, and randomized controlled trials have shown us exactly which practices save lives and which ones cause preventable deaths. Common sense isn't enough when the danger isn't obvious. You couldn't see the botulism spores in honey. You couldn't see the risk of SIDS increasing with stomach sleeping. These dangers are invisible, which is why they're hidden. But they're real, they're measurable, and they're preventable. Your experience raising children successfully is valuable, and most of what you did was exactly right. But in areas where science has proven a danger, we have a responsibility to adapt. Drop a comment below and tell me which danger surprised you most. Also, let me know where you're watching from because safety guidelines can vary slightly by country, and I want to make sure I'm addressing the recommendations for your location. If you found this helpful, share it with other grandparents in your life. The best way to keep grandchildren safe is to build a community where we all support each other in learning and growing. Don't let pride or defensiveness prevent you from making these changes. Your grandchildren need you healthy, informed, and safe. You have wisdom that young parents desperately need in areas like emotional regulation, patience, and perspective. But combine that wisdom with current safety knowledge, and you become the invaluable caregiver you want to be. One more thing. Many grandparents tell me they feel criticized by their adult children around safety issues, and it creates family tension. Here's my advice. Approach every safety conversation as a team effort. Say, I want to follow your rules exactly. Can you show me? Rather than debating whether the rule makes sense. Remember, these are their children, and they have the final say. Your role is to support them, not to undermine them. When you demonstrate that you respect their parenting decisions and you're willing to learn current guidelines, you build trust. That trust means they'll ask you to babysit more often, and you'll get more precious time with your grandchildren. That's what we all want. If you're watching this, you clearly care deeply about your grandchildren's safety. That care is what matters most. Now you have the knowledge to match that care with action. These 10 dangers are preventable, every single one. Make the changes, have the conversations, take the classes, and you'll have peace of mind knowing you're giving your grandchildren the safest care possible. Thank you for watching, and I'll see you in the next video where I'll discuss the emotional safety issues that are just as important as physical safety. Subscribe so you don't miss it.